Hello. This is an approach to the counseling stations in general. First of all, you will enter the station. You will try to greet the patient like the normal grips. After that, you will build a rapport with the patient. Here comes diversion. Sometimes the station can be like disclosing test results. Sometimes it can be assessment of risk of a disease. Some other times it can be drug counseling station. The fourth option is surgery counseling or an operation counseling or any procedure counseling. In the four cases, usually you will start the station by asking the patient what brought you to the hospital today. He will tell you the reason, either test result, either follow up of a disease, either he wants to know about an operation, how it goes like, and maybe he's coming for drug check. So the patient will tell you the reason right now. Your mission here is to take history. For example, why did he do this test? Number one. Number two, in the second option, is that why he is taking this drug? Number three, why is he undergoing this operation? Number four, um, why he is worried about this disease, which is coming to check his risk to develop. So number one, take history. He will tell you the reason. Now you will elaborate. How to elaborate any counseling station by taking history, which is a maftusa. For example, if he is worried about stroke, you will ask him, number one, about if he has any symptoms of stroke. Number two, some of the maftusa like the past medical history, like for example, if he has any medical disease, like high blood pressure, high blood sugar, high cholesterol, heart disease, blood disorder. So this is called risk assessment. So number one, symptoms of the relevant condition. Number two, other risk factors from medical conditions and drugs. This is if the station is disease risk. Number two, if the station is medication. Your history portion should include the side effects of the relevant drug. For example, if he is coming for follow-up of the warfarin, you'll ask if he developed any of the side effects of the drug. Number three, if the station is test result, you will move to the past medical history, like ask about the DDs, the differentials of the condition which he is presented with. For example, if he did test results to check, or if he did this test because if he is having tiredness, so your history here is about the differential diagnosis of the tiredness. You should rule out other DDs for tiredness. Number four, if it is an operation, your history here will be concise around the risk factors, I mean the reasons for him developing or undergoing this operation, and the risks which can increase complications after surgery, like any infection, any diabetes, any fever or flu-like illness, any heart problem, any kidney problem, any medications he is receiving. So number one, asking the reason. Number two, taking relevant history. Number three, lifestyle. Don't ever overlook the lifestyle in counseling stations. It will barely take you half a minute. Please do not overlook it. After that, you can examine the patient if relevant. You can verbalize the examinations, no problem at that. Then move to the management portion. In the management, simply, first of all, you will use ICE. How to use ICE in the counseling stations? In the counseling stations, you basically use the ICE, which is number one, the idea you use it after disclosing the management. For example, after disclosing that he is at high risk of developing stroke, you will ask him, do you have any idea why you are at high risk? Then he will tell you, no, doctor, you tell me. Now you will disclose your management. For example, you will say you are at high risk of developing stroke because of some things that we can because there are some risk factors you're having. Some of them we can't interfere with them, like your age and your family history, and some other things we can interfere with or we can tackle, like your high blood pressure and your lifestyle. And for the drug counseling stations, you can use ICE, for example, after disclosing it. For example, if the patient developed one of side effects, you tell him, actually, This is one of the side. Actually, no, you will ask him, do you have any idea why did you develop this side effect, or why did you develop, for example, this cough? He will tell you, no, doctor. You will tell him, actually, this is one of the side effects of this medication. But please, in any drug counseling station or in any drug prescription, do not ever forget to open the BNF. Do not ever forget to open the BNF. It will barely take you 20 seconds. Okay, if it is a surgery, you will ask him about his idea. Okay, do you have any idea how, or do you have any idea, or have you been explained about the surgery? So check his idea after. The first thing in management and counseling stations is to check his idea. Okay, okay. And the test results, you can ask him. Actually, you came for test results. Do you have any idea about the results? Uh, he will tell you no. Now you can tell them. Okay, after disclosure, now have a pause. Because he will ask you, and what is this, doctor? You will explain more to him in details. Okay, after disclosure and explanation, now you will tackle the management. Basically, your management will be lifestyle and follow-up. Lifestyle and medications, or follow-up. Lifestyle and medications or follow-up. So there are some things that you can do and some other things that we can do. What would you like me to start with? He will tell you, for example, tell me what you can do for me, doctor. What you can do as a doctor is usually number one, medications, number two, following him up by investigations. And what the patient can do, please advise him about the relevant lifestyle. And if he needs, like if it takes you longer, you can always involve the dietitian in the diet, like just say two or three sentences about the diet plan, and then you will say, and of course we will refer you to a dietitian to guide you properly. And if you are confused about the physical activity, you will guide him about the gym instructor as well. Please do not overlook to address the lifestyle. It can be quite long, but you can simply cut it into two or three sentences. For example, I used to tell the patient, I'm sure you agree with me that having a healthy diet also can have a good impact on our lives, right? Okay, what I suggest in your case is that you can follow healthy, balanced diet, for example, and instead of relying on the junk food, which can sometimes help you or which can lead you put on much weight, why don't we try cooking like for once a while and freezing it and maybe warming it in the microwave in your job place. Do you have microwave there? They'll tell you, yes, doctor. Okay, that's brilliant. You can try it once or twice per week, and I'm sure you'll get used to that in a while. That's how you can address the patient and speak about the lifestyle. Usually, the lifestyle things you can speak about them for ages. It will be the nicest part of the station. Please do not mess it up because people cram it and they lose marks in the lifestyle because they speak too much and they give too much advices without checking the patient understanding. Again, to sum the stations up, number one, assess the reason. Number two, take some history. Number three, past medical history or maftusa. Number four, lifestyle. Number five, examine. Number six, ask about the idea. Number seven, disclose. Number eight, explain in details. Number nine, address the issue or manage it or set a management plan. Things that we can do and things that you can do yourself. What would you like me to start with? He will guide you through. In the very end, you can put some safety netting and warning signs, like you will tell the patient, for example, if you develop any weakness in one of your limbs, or if you develop any slurred speech or any facial weakness, please come back to us, for example. If you have any questions, please do not feel free to contact us. And if you have any concern, please share with me. Usually, while advising the patient in the counseling sessions, you will always say this sentence. If you have any do you have any concern so far? Am I clear? Okay, this question is very important to ask him in the counseling because in the counseling you are supposed to speak much. So please do not forget yourself, okay? And do not preach without checking his understanding. I hope this recording was helpful for you. Please keep it for yourself, Okay, this is a general approach. Please apply it on any counseling station. Follow it by heart. Do not confuse yourself in the ocean of scripts. Just follow this approach in any counseling station, and I'm sure you will rock.